What do you need to know? The history and evolution of the eligibility and benefit verification process, pre-HIPAA era to post-administrative simplification, developed and presented by the Eligibility and Benefits Workgroup, a WEDI workgroup. WEDI, the collective voice of health IT. Does anyone remember pre-year Y2K how you'd make a doctor's appointment? Did you have a fancy smartphone then with an app to your MyChart, or better yet, a provider finder? Highly doubtful. I bet you used a white pages phone book to find your doctor's phone number, or maybe Mr. Google, probably when you had an AOL.com email, or had it written down in a contact folder, or even a Rolodex. When making that appointment, you'd only really need to tell the registration staff your name, date of birth, maybe your member ID, and the reason for the visit. Any other information you had about yourself that would help them schedule you. You'd show up on the day of the appointment. If you had a member ID card, it was probably flexible paper that would tear or otherwise be cheaply made. They'd copy it and make a copy of your driver's license too. Some still do. Sometimes you'd have to recomplete paperwork that required you to acknowledge you're responsible for the portion not paid for by your insurer. Remember those days? Some of this, of course, still applies today. The provider would call the healthcare insurer and verify your insurance. Get some basic info on the financials for the appointment, usually to verify if you have a copay. And either upon check-in or check-out, you'd pay the fare for the visit. Fast forward to 2002 through 2014, when HIPAA version 4010 and 5010, as well as CAQH core operating rules, were adopted and mandated under administrative simplification. We now have a technical format to follow to exchange that once manual eligibility and benefit information and some basic data content and infrastructure requirements to adhere to, intending to make it easy for a provider to validate that member's coverage and provide that member on their best path forward for their health. The option to make an appointment became doable via an online portal, and you could validate your insurance information by taking a photo of your insurance card with your fancy smartphone and upload it to the provider system. Wow, efficient and effective. Zoom forward to 2020 and the pandemic, where you now have the opportunity to have your doctor appointment virtually. How far we've come in just 20 years. Sounds ridiculous to say 20 years brought us so far, but really it has, and we have so much more to do yet. Through this evolution, one thing stands out. The eligibility and benefits verification process is a mighty one. It's the first step in a patient-provider journey. It's how the provider knows they and the member have eligibility for medical coverage. It's how the provider can begin to help a member with their care management. How, you ask? Well, simply, the eligibility of a member, the type of healthcare coverage, and the benefits the coverage package includes is key to knowing what's next. It's one of either the appointment scheduling, the appointment itself, and the post-visit care plan the provider and patient will embrace. All starts with that eligibility, coverage, and benefits. It's what brings patients, providers, and payers together. But it's not all unicorns and rainbows, unfortunately. The biggest misstep in the eligibility and benefit exchange is the need to identify the patient on that inquiry to the healthcare payer. The eligibility and benefit exchange starts with some important information the patient must have available for the provider to verify the patient's coverage. The most important piece of data is the patient's member ID, by which the healthcare payer will recognize the member. For those who are aware, the 270-271 is one of the HIPAA transactions developed by X12 to support the needs of the healthcare provider-payer industry and to streamline the administrative and financial workflow. The member ID is just one of 4 pieces of membership data that is used for a matching process on the 270-271. The other pieces supported for patient matching are the patient's first and last name and the patient's date of birth. In the 270-271 eligibility and benefit transaction, these 4 pieces of member information are the only 4 data points a healthcare payer is allowed to require be sent by the provider on the 270. However, the provider should note that sometimes the payer may ask, and is allowed to ask, for additional information to ensure there is a proper match. That additional information that may be requested, but again cannot be required, could include the patient's address, city, state, and zip, or account or group number information. We joke and say shoe size and eye color, but honestly, there's no place to put that on the 270. The identification of the member is the most critical step to ensure the provider has the necessary information about the patient to provide a seamless workflow for the provider when conducting follow-up steps, such as requesting a prior authorization or submitting a claim, verifying clinical summaries, such as previous lab or diagnostic tests, and avoid repeating if they were within a reasonable time frame. This is also an opportunity to drill down to the patient's benefits and create the care management protocol the patient needs to address a health or wellness issue. The benefits portion of an eligibility and benefit exchange also identifies the patient's financial liabilities, such as what the patient costs are at the time of the visit or post-claim when the claim has been adjudicated by the healthcare payer. Take a look at what that transaction path may look like in Diagram A. It's a version of a simple picture of when the eligibility and benefits verification may play a role in the registration, appointment scheduling, medical dental visit, prior authorization, and claim workflow process. But that eligibility and benefit verification process is not only one that begins and ends at the appointment scheduling or visit time. It could happen over and over again at various points of the healthcare workflow. So many possible eligibility and benefit verification checkpoints that it's almost the opposite of administrative simplification. Long story short, the eligibility and benefit verification process is the foundation for the patient's medical journey. Nowadays, providers use a portal to do that patient verification or may have a tool built in their practice management system. The patient's member ID, first and last name, and date of birth are submitted along with some information identifying the provider. The provider is usually going to need to identify the scope of their benefit inquiry by identifying the service in question. In technical terms, this would be the service type code that most people are familiar with who are familiar with the HIPAA-mandated 270-271 Healthcare Eligibility Benefits Inquiry Response. It can couple with other benefit information such as places of treatment, diagnosis codes, or could be instead a procedure code. There unfortunately is very little adoption by healthcare payers using procedure codes on the 270. Why is that the case when procedure codes can be a strong mechanism to determine eligibility for a service? Well, it's a very difficult mechanism to use when you're often doing an eligibility and benefit inquiry pre-service, before the provider has even visited with the patient. It often will have a lot of nuances, such as the provider's diagnosis and treatment availability. Sometimes can even be hard if that provider who's rendering the diagnosis isn't the provider who can treat the patient, as the provider might need a specialty of sorts and or there may be a need for additional medical opinions before a treatment plan is secured. In any event, the move to support procedure codes is beginning, as the newly recommended for adoption Core Operating Eligibility and Benefit Data Content Rule will require procedure codes in a subset of high usage categories, such as surgical, imaging, physical therapy, and occupational therapy. There's also no need to wait to handle procedure codes on the eligibility and benefit inquiry response exchange to start supporting the procedure codes. How's that exactly? Well, if a healthcare payer can support returning procedure codes that can be related to the submitted service type code on the 270, then they can send the eligibility for the service type code and then another benefit block of data with the procedure code information. In the words of Ina Garten, how easy is that? Well, really, it's not that easy, but it sure is advanced thinking. The details that are needed today from payers to provide service to a member are a lot more than they were 10 years ago. And 10 years from now, there'd be that much more need. Essentially, we need to move in a direction that supports the eligibility and benefits verification in a way much more granular than we're ready to admit. Whether it be supporting detailed pharmacy benefits determination or supporting a subset of procedure codes. Either way, the industry needs to advance, as not doing so will prove to be more burdensome for all involved. No better way to start advancing than taking baby steps to move the needle. What has your organization done in terms of advanced thinking to help move the needle? Please comment and share.